Hi, welcome. In this talk, I would like to talk about my personal thoughts and experiences about how large language models, LLMs, can be used in medical education. So the contents of my talk comes from a commentary article I wrote in Korean Journal of Medical Education. The impending impacts of LLMs on medical education. And in this article, I talk about 4 abilities of large language models and how each ability can be used in medical education. So let's go over by each of them one by one. The first ability is information retrieval, and the students can use this to do self-learning with dynamic text. So let's think about a situation where the professor during class mentioned that violet light can be used to treat myopia, and then just moves on to the next topic. However, the student gets curious and they go to ChatGPT and ask like this: write a study note about violet light and myopia for a medical student. Then instantly, the student can generate a very detailed and accurate study note. However, maybe the student has English allergy, 에고 알레르기가あるんですけど, or maybe 영어 울렁증이 있을지도 몰라요. So in this case, since these chatbots are multilingual, they can accurately translate the text into a preferred language. After studying with this study note, maybe the student wants to assess their understanding after learning. They can ask to generate some OX quizzes and some explanations. Using this, they can study even further. So this concept of dynamic text mentioned here, dynamic text generated from large language models, is a relative concept with static text. Our traditional learning materials like textbooks and articles. So this kind of static text is usually fixed content and it is same for all users. However, dynamic text generated from LLMs can be very individualized. It can adapt to users' needs for each and every person. Static text, the author writes what is thought to be important. However, the LLM generated dynamic text, it can be based on users' curiosity, so it can be different for everyone. Static text usually is very slow in updates. Think about waiting for the next edition of a textbook. However, the accuracy is usually higher. On the contrary, dynamic text can be very frequently updated, or you can even attach a very new article and ask to generate a study note based on that new information. However, there is always some risk of the large language model to generate some hallucinated information. Here is an example I have wrote in Korean Journal of Medication. It is a teaching tips article. It is about a use case of ChatGPT in a flipped classroom setting. So this was a medical terminology course for the first grade students, and I provided 5 prompts and some explanations of how to use them. The first prompt is about generating some study material. The second prompt is about studying the etymology of these medical terminology. And the third prompt is, what are the 3 most important points in this lecture? So these first grade students, they usually have a very hard time determining what is important and what is not. So I think this kind of prompt can help the students throughout their 6 years of study. The next prompt is, what are the 5 questions students may ask after this lecture? Provide detailed answers. So this kind of prompt can help the students to dive in deeper to the material they have generated. And the last prompt is, make a concise material suitable for a 15-minute PowerPoint presentation. Since this is a flipped classroom setting, the students have to study beforehand, before coming to the classroom. And in the classroom, the students have to make a presentation. So this kind of prompt can help the students to draft their presentations. Let's move on to the second ability is it is essay generation. These chatbots, they generate perfect, high-quality essays. So our traditional evaluation methods, having students to hand in reports, does not work anymore. We have to adjust our evaluation methods. So in this commentary article, which was accepted just 2 days ago, I propose 2 different categories of new type of assignments. The first category is AI resistant category. For example, we can have the students to write down the multi-stage reasoning processes during their work. So this type of assignment, we require the students to document their progress. So instead of just handing in the final product, the students have to write their intermediate results. So in this case, the students cannot automate the entire process. The next type is assignments that require personal reflection. You can have the students write some content based on their very personal experience. So this type of assignment is also resistant to automating with AI. The next type is some open-ended creative task. Follow your curiosity. So in this type, the students are less incentivized to automate everything because it's about what you are curious about. The next are collaborative activities that require peer interaction and oral presentations. In case of oral presentations, even though you can generate the script using AI, you still have to understand the contents in order to speak out in your own words. The next category is quite the opposite from resistant assignments. It is AI augmented assignments. So in this category, the teacher provides some prompts to generate outputs, and from that output, the students are directed to do some sequential tasks, like identifying problems or modifying the output, or requiring some activity that uses metacognitive reflection. So let's have a look at some examples. This is an actual assignment I gave out to our students. I gave a YouTube link, and it is an interview about large language models and medicine. So the students have to answer to 4 questions in the report. The first 3 are like, what are LLMs gaining? Why are LLMs gaining traction in medicine? What is hallucination? Its meaning in medicine? How do you reduce hallucinations? So these kind of questions can easily be answered by AI. However, the last question is, one thing from the interview that sparked your curiosity and what you've personally researched about it. So this type of question, the students are not less incentivized to generate the answer automatically. It's about what you are curious and what you want to dig into. So I think this kind of assignment is a very good example of AI resistant assignments. The next category is AI augmented assignment. So in this case, you provide a prompt to the students and have them generate 2 analogies about an important concept they learned during class. And sequentially, you ask, which one do you think is better and why? So the student generates 2 analogies, and then they have to read the output and then write about their thoughts about the 2 examples. So this kind of assignment induces the students to assess the LLM output. And I think this kind of ability will become more and more important for the students, where AI becomes more abundant in their learning environment. Let's move on to the next ability. It is generating human-like speech. So I did a study with our 4th year medical students. We built a virtual patient chatbot that lets the students to practice medical interviews. So you can type in your questions. What brings you here today? My knee hurts. When did the pain start? Since 3 months ago. And then you can continue. And then you can insert an input that you are finished and write down your probable diagnosis. And after the interview, this large language model based tool, it provides a structured format formatted feedback about any missed points or areas for improvement. And we had some of our students interact with this chatbot. And then we performed some questionnaires. So the first category is comparing their experience with the learning during conventional methods, which is in blue, and their learning experience using this chatbot. So as you can see, in all questions, the students answered that they had a better experience, higher satisfaction during their learning experience with the chatbot. And then we also asked the students to compare the feedback they get from standard patients while they practice face-to-face medical interviews at school. This is in green, and compare it with the feedback they got from the chatbot, the structured formatted output report. So as you can see, they showed much higher satisfaction with the feedback from the chatbot. The last ability of large language models I want to talk about is the ability of chain of thought. And we can use this to learn clinical reasoning. This is a very interesting paper. It's titled, Can Large Language Models Reason About Medical Questions? And it has been published in a Cell Patterns paper. So we can input a USMLE question and have the chatbot immediately answer what is the answer. However, the chatbot output, the accuracy is usually very low. However, if we prompt the chatbot to start their answer with let's think step by step, and then continue the answer, the large language model will write down their thought process, their chain of thought, and then at the end we can have the chatbot to generate an answer based on this chain of thought. Then the answer accuracy becomes much more higher. So inspired by this, we performed a prospective study where we give the students a question list, thought-provoking question list generated by GPT, and we compared it with the group where the question list was actually generated by internal medicine professors and compared the outcomes. The details of the study will be presented by my student after my talk. So this is my last slide. How should we adapt in this new world? I think our lectures should move away from merely delivering information. We have to move to stimulating curiosity and teaching the enjoyment in learning to our students. In case of our school, we are using criterion referenced assessment. We give out pass or fail grading. So our students only need to avoid failing, and they have much more free time compared with other schools. So during class, we only have to provide essential and overarching contents, and at their free time, we can encourage students to pursue deeper questions independently in the form of inquiry-based self-learning. And if the students learn this habit, it can be expanded into continuing medical education, CME, which will become more and more important in such a fast-changing world. I also want to stress that the educators' computer and AI literacy is also very important. We have to learn how to use these new tools. For example, I use Kahoot to give out quizzes right after my lecture, at the end of my lecture. So these kind of tools are very engaging. The students get to have a very fun experience retrieving what they have just learned during class. And this active actively experiencing these new tools is needed to understand the actual environment our students are learning in. And based on this understanding, I believe we can give a better teaching and better learning experience, do better teaching and give a better learning experience for our students. Okay, that's it. That's all I have for today. Thank you for listening.